What's going on, guys? Tony Maritato here. In this video, we're going to talk specifically about Section 40 of the Medicare Benefit Policy Manual, where it discusses the ability for a provider to opt out of Medicare, the mandatory claim submission, and how that relates to your cash-based physical therapy, occupational therapy, or speech practice. And I'm going to show you the one sentence in all of this policy that to me says, you know what? Don't even try or worry about your inability to opt out. Like, this one sentence to me negates all the arguments and just makes it not even worth it. So guys, let's jump into the computer and I'll show you what I'm talking about. This has been a growing, an article that's been growing in popularity. Cash pay physical therapy, ensuring compliance with the Medicare Mandatory Claim Submission Act. Submission Rule. So in this article, read it, it's a great article, lots of information in here. They basically present two cases. They say on the one hand, there are those providers who believe Medicare has no control over them if they've never enrolled in the Medicare system. Now, the more conservative side of the argument is we have to assume that as healthcare providers, we are under the umbrella of Medicare, even if we've never become a provider for Medicare. And the opt-out rule and the mandatory claim submission rule applies to us regardless of whether we're par or non-par or completely unaffiliated with Medicare. And so throughout this article, they give great information about Medicare terminology. So for example, the difference between participating and non-participating suppliers, an opt-out supplier, covered services, advanced beneficiary notice. Definitely put this in your library, read through it, go check the resources. Super helpful information. What I'm going to do for you is I'm going to jump straight into the Medicare Benefit Policy Manual. So if you want to find this and you don't know where it is, just Google CMS Chapter 15 and this PDF will show up. And you can see that this was most recently updated on February 19th. So pretty current for this year. If you scroll down here to Section 40, this is where all the information is going to be found. And what we're going to do is we're going to kind of go in reverse order. So first, Section 40.33, that is where you'll find information on the mandatory claim submission law. It's a federal law basically stating that if you provide a covered service to a Medicare beneficiary, you have 12 months to submit that claim on the beneficiary's behalf. It's a violation of the law if you do not submit the claim for that beneficiary. You can read the law. There's an endless amount of information in there. If we jump over to Section 40.4, this is where it outlines who may opt out of the Medicare program. So physical therapists, occupational therapists, speech therapists, we are not on the opt-out list. Hence, the assumption is, until it's tested in a court of law, that we fall under the mandatory claim submission umbrella. So this is where you'll find the list of providers who may opt out. Now, this is what you guys have been waiting for. This is, to me, the most important part. My question to you before we get into this is, why do you want to opt out? Assuming you could, why do you want the Medicare beneficiary to be able to pay you a cash rate? Why are you just not a Medicare provider? The assumption is you don't want to deal with the Medicare regulations and you want to be able to charge your cash rate. In most cases, your cash rate is going to be significantly higher than the Medicare allowed amount. And to provide the level of patient experience and care that you are looking to provide, you can't do it for the Medicare allowed amount. So you're in a position where for your business to operate, you have to charge that higher rate. So what options do you have? Now, you've probably heard the Medicare beneficiary of their own free will may refuse to allow you to submit that claim information to Medicare. But even if that's the case, which would allow you to treat that Medicare beneficiary, provide a covered service, did you know that you're still not allowed to charge your cash rate if it's above the Medicare limiting charge? So let's take a look at this section. I'm going to read it to you verbatim. Under section 40, right at the top, when we go down to only physicians and practitioners that are listed in 40.4 may opt out. We already saw we're not on that list. The only situation in which a non-opt-out physician or practitioner or other supplier are not required to submit claims to Medicare for covered services is where the beneficiaries or the beneficiary's legal representative refuses of his or her own free will to authorize the submission of a bill to Medicare. Okay, so a lot of people are stopping there and they're saying, hey man, we're in the clear. The beneficiary wants to pay. They're refusing to allow me to submit that claim. I don't have to worry about the mandatory claim submission rule or law. Okay. However, the limits on what the physician, practitioner, or supplier may collect from the beneficiary continue to apply to charges for covered services, notwithstanding the absence of a Medicare claim. So the whole idea is you still cannot charge more than the limiting charge. That handcuffs you to that dollar amount. Now, if you don't know what the limiting charge is, find my link up above. I go through how to look at what the limiting charge is for a par, non-par provider. But the idea is if your bill rate's $250 an hour, you can't bill that. You can't charge that, even if the beneficiary refuses to allow you to submit that claim. So that is where we need to take this in a different direction. And that is where I've been really focusing on drilling down what is a medically necessary service, what is a covered service. Because if you're not providing covered services, you are not subject to the mandatory claim submission rule. So there is a real kind of gap in the information that we as clinicians learn through school, but it's all outlined here. So my homework assignment to you, if you really want to take this to the next step, deepen your level of understanding, is come to this document, go into the table of contents, scroll down to section 220, and you're going to come down here to reasonable and necessary outpatient rehabilitation therapy services. This is where you're going to start to research the information on what is a covered service, what is medically necessary, what their definition, the CMS definition of this is, and how that relates specifically to the patient experience and the services that you're delivering. Guys, I hope this was helpful. I hope this shed at least some light, gave you some legitimate resources to go out and continue to learn about mandatory claim submission, about the opt-out rules, so that you're not just practicing to the best of your clinical ability, but you're practicing within the guidelines that we're able to practice within. So guys, I'll catch you in the next video. If you haven't already, subscribe to the channel, ring the notification bell, and I'll see you soon.